You can go whenever you want to.
Oh. Hi, my name is Rosalind Pichardo of Prevention Point, Philadelphia, and I am their lead educator and community engagement liaison. And I'm going to show you how to administer Narcan if someone is overdosing. So some of the signs of someone who is overdosing is 1, unresponsiveness, 2, bluish in the face if they're light skinned, but if they're dark skinned, more of an ashy tone. So what you want to do is first determine if this person is actually overdosing. So you're going to try to wake them up. Sir, ma'am, are you okay? And if they're still unresponsive, you're going to let them know, hey, I'm going to administer Narcan. And if they're still unresponsive, you're going to take your knuckle and you're going to rub their sternum. And if they don't wake up after the sternum rub, you're going to go ahead, put your gloves on. You're going to check your surroundings. Also have someone call 911 so that if you only have 1 dose of Narcan and that person potentially may need 2 or 3, that help is coming. So we're going to go ahead. I got my gloves on. I'm checking my surroundings and I'm taking the Narcan out of the pack, which looks like this. And you're going to go ahead and tilt the head back, do bunny ears, insert the tip, and then push the red button up, allowing the meds to flow. And once you've done that, you're going to look safely into the mouth to make sure there's no needle cap syringes inside of the mouth. And if there is, you're going to gently swoop it out. Take your face shield, which comes in a packet like this, and it looks just like this. The nose and then the mouth, you're going to place the nose to the nose, the mouth to the mouth, and you're going to pinch and you're going to give them 2 rescue breaths. And then you're going to count 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi. 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi. You're going to do this for about 3 to 4 minutes. If that person is still unresponsive after the 3 or 4 minutes and they're still looking the same, you're going to go ahead and take another dose of Narcan. And again, the same procedure. You're going to tilt the head back, bunny ears, put the tip inside the nostril, push the red button up, allowing the meds to enter the nostril. And then you're going to proceed again with the rescue breaths. Once you've done that and you determine that the person is looking better, they're moving a little bit more, the color is looking good, you're going to go ahead and roll them to their side so that they don't aspirate. Once you've done that and they're looking better and they're starting to talk, you're going to go ahead and sit them up and just let them know what's happening, that they just overdosed. Let them know how many Narcans you gave them, because that's going to determine how sick they're going to be. If you've given someone 1 dose of Narcan, they're going to feel queasy. But if you've given them several doses, 3 to 4 doses, they're going to feel the immediate effects of withdrawal. So you just kind of want to prepare them for what they're going to feel for the next couple of hours. Just let them know that EMS is coming and they're going to take them to the hospital. They have an option if they want to go. So it's really up to them. So that's one way of administering Narcan. Another way that we can administer Narcan, again, if someone's in the wheelchair, in my community I find a lot of my sunshines that are in wheelchairs. So if you find someone that's overdosing in a wheelchair, we're going to pretend this is the wheelchair. We're going to gently find someone's steps, wheel them to the steps backwards, allowing the handle to touch the stairs. You're going to put the wheelchair in lock and tilt the chair back. That's going to allow the neck to have that natural flow going back so that when you do the rescue breaths, they have a clear airway. And you're going to go through the same motions of, again, calling 911, making sure the mouth is clear, administering Narcan, giving them the rescue breaths. And again, you want to make sure you don't take anyone out of the wheelchair because you don't know what's underneath the sheets. It can be someone who's an amputee, colostomy bag, spinal cord injury. We just don't know. So we don't attempt to take anybody out of the chair. So once we've done that, you let them know that EMS is coming, and just remind them not to use for the next couple of hours because the Narcan is not only not going to allow them to get high, but if they try to use, if the Narcan wears off, they can possibly OD again. And that's pretty much it on how to administer the nasal form of Narcan. Yep.